Good morning, everybody. Welcome to today's webinar, The Climate Crisis and Our Health, Why Action Matters in New Mexico. First of all, I want to thank our co-sponsors for this event, the New Mexico Public Health Association, Moms for Clean Air, Conservation Voters in New Mexico, and Climate Advocates, Voices You Need Them. Health Action, of which I am the director, is based in Albuquerque, and since 1995, we have worked to empower consumers to build healthy communities and secure better health care for their families. We care deeply about protecting the health and the future of New Mexican families, and one of the best ways to do that is to cut pollution now and avoid future health care costs later. Today, we're going to hear from state regulatory and policy leaders, climate change and public health experts about how climate change is affecting New Mexico, how it is impacting communities and public health, and what we must do about it. To kick us off, please welcome New Mexico Department of Health Cabinet Secretary Kathy Kunkel.
Thank you for inviting me to speak this morning. The Lujan Grisham administration, for our administration, environmental issues are public health priorities. This focus helps to break down silos between public agencies and looks for integrated strategies based on connections between the environment and disease. As Governor Lujan Grisham outlined in her 2019 executive order on addressing climate change and energy waste prevention, climate change creates new risks and exacerbates existing vulnerabilities in all communities across New Mexico and presents growing challenges for human health and safety, quality of life, and economic growth. The Department of Health participates on the Governor's Climate Change Task Force, which was created to support the executive order on addressing climate change. The department focuses on the impacts of climate change on human health. This is accomplished through a plan taken from the CDC's project known as Building Resilience Against Climate Effects, or BRACE. The work group uses BRACE, a BRACE framework, to forecast climate impacts and assess vulnerabilities, project the burden of disease, assess public health interventions, develop and implement a climate and health adaptation plan, and evaluate the impact of these activities. These steps are being applied to study the impact of rising temperatures on heat-related illness forecast projections. Over the 10 years from 2008 to 2018, emergency room visits for heat-related illness in New Mexico have almost doubled, going from a rate of 9.2 visits per 100,000 population in 2008 to 17.4 visits per 100,000 in 2018. Our task force has also researched climate models from agencies such as the National Oceanic and Atmospheric Administration to include temperature change parameters in the heat-related illness projection model. They developed a climate change vulnerability index to determine which communities have the capacity to respond to the stress of climate change based on socioeconomic, environmental, and healthcare accessibility. Using emergency department and hospitalization data, along with temperature data, they forecast excess morbidity. And they've assessed what is currently being done in New Mexico with regards to emergency response for excessive heat and best practices for communities. Our Climate Change Task Force is evaluating policies and regulatory strategies to achieve reductions in greenhouse gas pollution. Passage of the Energy Transition Act has put our state on a path to ensure that by 2045, the electricity grid will be 100% carbon-free. In closing, the state is committed to a coordinated interagency strategy to support the 2015 Paris Agreement goals and to achieve a statewide reduction in greenhouse gas emissions of at least 45% by 2030. All state agencies are evaluating the impacts of climate change on their programs and are integrating mitigation practices into those programs and operations. We're on a track this year to put in place state rules to reduce methane waste and pollution from oil and gas operations. It's important that we get this right to reduce air pollution that disproportionately impacts the health of children, seniors, and rural communities. Thank you again for this opportunity to speak on this critical subject.
Thank you so much, Secretary Kunkel. Now we're going to hear from New Mexico Speaker of the House, Brian Egoff.
Hi, thank you for the invitation and for having me on. And Barbara, thank you so much. And Madam Secretary, good morning to you. We in the State House of Representatives have made addressing climate one of our top priorities over the last two sessions, and will continue to make New Mexico a climate leader nationally and globally. The threat of climate change is real. We understand it to be real. We are taking it seriously. We understand the challenges, but we also understand that there are opportunities presented as the state adopts strategies to adapt, to mitigate, and to reduce New Mexico's contribution to carbon emissions and climate change. In 2019, we demonstrated our commitment to being a national climate leader when we passed the Energy Transition Act. It was a partnership between the legislature and Governor Lujan Grisham that has set us on a path to 100% renewable electricity. We know that it's not only possible, but it is achievable. The law in place now has us on path to 80% renewables by 2040. And we know that with developing technology, that the last 20% by the time we get there should be absolutely achievable. Moving to renewable and emissions-free electricity is a critical step for New Mexico's long-term sustainability. It is also a critical step for prosperity for New Mexico's communities, to make sure that we are at the forefront of the transition to a clean energy future and all of the jobs and economic benefits and environmental benefits that that brings with us. In the 30-day session that ended in February, we passed a renewal of the New Mexico Solar Tax Credit. The intent is, of course, to boost residential solar use, and we also modified a law that I got passed way back in 2009 dealing with PACE, Property Assessed Clean Energy, to allow commercial properties to pursue property assessed clean energy with a pilot program hopefully starting soon in Bernalillo County. New Mexico, of course, we have 310 days every year of sunshine, and we should be taking full advantage of our state's abundant and world-class solar resources. Last week, the State Land Office announced a 118% increase in revenue from wind energy projects, which is a very important step in diversifying our state's revenue sources to begin to once and for all end our state's reliance or dependence on so much of our revenue coming from a single industry. So wind is a very exciting opportunity for New Mexico. But maybe the most exciting thing of all this year was the decision, the unanimous decision out of the Public Regulation Commission to approve over $1 billion in new investments in renewable energy and battery storage under the implementation of the Energy Transition Act. And it is a huge new development, 650 megawatts of solar energy, 300 megawatts of battery storage, which will make it one of the largest battery storage projects in the country, and all of it placed in an area where the economic benefits of that are sorely needed, that being northern Rio Arriba County, McKinley County, and San Juan County. We are seeing that the economic realities are driving more investment towards renewables and a green future as coal and natural gas and other old resources are becoming more expensive. As that trend continues, we will make leveraging our state's wind, solar, hydro, geothermal, and other renewable resources to make sure that we're meeting our state's and also our nation's energy needs. We would love to become a net exporter of clean energy because it helps our sister states achieve their climate goals, but it also provides a terrific economic benefit for our state. And by doing that, we'll be creating quality jobs right here in New Mexico and make it easier for folks to stay here after their education, raise a family, and sink roots deep into our wonderful state. Next session, we are working on adoption of a comprehensive plan building on the Energy Transition Act to set emission limits in other sectors of our economy, reduce CO2 emissions and other greenhouse gases. It is an absolute priority for me for the legislature to get to the governor a comprehensive climate package this next session. We're well underway working on it, and we'll be announcing more details shortly. Again, at Health Action New Mexico, I want to just thank you for all that you're doing to highlight the public health needs and the situation here in New Mexico, and for recognizing the connection between our natural environment and public health. And I look forward to working together with you more to continue to build on our state's leadership in health and climate and all the work that you're doing. So thank you so much, and I hope folks watching enjoy the rest of the webinar.
Great. Thank you so much, Speaker Egoff. Lots of great information. And now we're going to hear from Dr. Dave Dubois, who is a climate scientist from NMSU. Dr. Dubois.
All right, thank you for inviting me. And good morning, folks. I'm going to just go right into talking about climate impacts. So there's a bunch of questions there. We can hopefully answer those in the online questions. So the first slide we got there's no doubt global warming. It's basically, we're seeing warming, and it's us. We can do something about it, and we're going to talk about both of those. So we're seeing about a 0.5 degree to a 0.8 degree Fahrenheit trend over per decade for summer temperatures and other times of year as well. I just wanted to show you this map showing by climate division where we're seeing the warming trends, and so you can do the math yourself. So even at a 0.5 degree Fahrenheit per decade, over several decades, we're going to exceed several degrees Fahrenheit on this track. You can go to the next slide here. So what some of the other recent observations have changed. Basically, we're seeing the temperatures of the last decade were the warmest of the century. The morning lows have not been getting as cold as they have in the past, and this is on top of the urban heat islands. We'll talk a little bit about that a little bit later. And we're seeing a longer growing season because of the temperatures, and as a result, in terms of health impacts, we're seeing more allergens. So the growing season longer, more pollens. So kind of put those two together. We're also seeing freezing levels getting higher in elevation. So in the mountains, you have to go just a bit higher to find freezing on average. And also we're in a semi-arid area. We get dust storms, and that's another issue with public health is dealing with dust as a respiratory as well as hazards. And it's also changing our snowmelt as well. Looking at all across the West, we share the same things that are going on in other areas in the West, warming, and that's a sure bet, and it's already happening. Seeing heat waves, hotter and longer ones, just kind of seeing even this past year, we've broken many records. Some areas are still exceeding 100 degree Fahrenheit highs. We've had near records in terms of the lengths and durations and intensities, and that's a sure bet, and we're seeing that in the future and already happening. Also, less snow in the future. It's excellent odds for happening, and it's already seeing that. Drier soils, less late winter and snow. Instead of snow coming down, it's rain transitioning, so that's not a good thing for hydrology. Less water in rivers, and also more frequent and severe drought. Good odds for that happening in the future. And the important thing is we're seeing hotter droughts compared to, say, the 50s. Even though they may be drier, we're seeing those that are now are hotter. So going to the next slide, I just want to show you just kind of some details, just looking at water resources. Just looking at declines in snowpack, we've been seeing that for several decades now. Less water available for agricultural users. Some we get, even though we may get some really wet years, but overall we're seeing a trend to changing our water resources, both the hydrologic system, surface water, and groundwater. And one of the things we're maybe looking at in the future is more rain than snow during the winter, which basically shows us an early snow melt. We saw that this year, and we're seeing, if you look at the Rio Grande past Albuquerque, you may be seeing some really dry areas. And also lower soil moisture in the summer is one of the other impacts. Next slide, I'm going to show the impacts to agriculture. And because of the higher temperatures we're seeing, and then in the future we're seeing this thing called evapotranspiration. That's the loss of water from both the soils as well as the plants. They're seeing stress on plants, higher water needs, lack of forage due to hotter and drier droughts, and we're actually looking at forage quality could change, and it's going to translate into cost of living and ability for folks to make a living in some of these areas, hauling water, a higher stress on animals, and reliability of existing water sources are threatened. And we're already seeing some of those already. Just focusing on the rest of this talk about health, one of the big threats that we're seeing all across the West is heat waves, and we're seeing a higher probability of those occurring, as well as with higher overnight temperatures. So we're not getting the relief we used to be able to, that when we open the windows, get cool off, we're not seeing that. Also, I mentioned earlier with the allergens, earlier in frost-free season, so those are some of the things that we're tracking over time. And it's just like right now, we're seeing the impacts of wildfires, not only just in New Mexico, but all across North America. And remember, things can be transported over. So we're seeing smoke from Colorado, Arizona, and California, and New Mexico. So we're all sharing in the same airshed over the North America. And we're seeing drought. We think about the increase of pathogens as things get condensed in terms of locations of water. Things are sort of more compact in those areas. So things are, we've seen those in the past, and also drinking water. So I'm going to go to the next slide. We did a study a few years ago looking at air quality is another issue that we're tracking. We're seeing, just as in Memorial Medical Center in Las Cruces, a 12% increase in cardiovascular ER visits when we see 10 microgram per cubic meter increase for all adults in warm season, and also ER visits, respiratory ER visits were increasing by a little over 5% for PM 2.5 for every 10 micrograms cubic meter. So we're seeing that in our areas. It's not just a big city issue. We're seeing it in New Mexico. Next slide, we're showing just a little bit more information on the heat-related illnesses. Mild symptoms to life-threatening or some, and I borrowed this graphic from the American Public Health Association, just giving you a little bit of numbers. And one of the things is basically the most frequent weather-related cause of injury and death in the United States is heat-related. So that should bring to elevated thought about what we should do to help people and awareness as well as mitigation. So the remainder of my talk, I'm going to go bit into. So those are some of the things that we're seeing and what we're thinking of seeing in the future, but what can we do about it? So I just want to show you some of the things. Speaker Egolf gave a great example of some of these. I just kind of give you some of the reasons why. So this is the inventory 2018 of the greenhouse gases. And we can see we're basically the largest sector is transportation, followed by electricity, and then industry. So those are the areas we need to look first in terms of getting the most impact to mitigate climate change. So the next slide there just shows you over the last 70 years where have we gone, where have we come from. So since 1950 to 2019, where has our electricity been coming from in terms of the fuel? So as you can see, that brown is coal, and right around 2005 or 6, we start to see a decline in coal, and natural gas has been basically taking up the slack on that. Although we really want to follow on that green slice there, the renewables. So we want to be able to increase those and replace the decline of the coal and increase in natural gas. We want to be able to expand that. And that's then following the next slide. It's going to showing just kind of for that 1 year, that last year on that last graph. So what is the breakouts in terms of U.S.? This is not just New Mexico, but the U.S. in terms of from the U.S. Energy Information Administration. So we're getting 38% of our electricity from natural gas, 23% from coal, 20% nuclear, and 17% renewable. So that's the area I want to focus in on. And over across the U.S. last year, 7.3% came from wind, 6.6 from hydro, 1.8 from solar. And so we want to, and that's why the next slide I just want to talk about where we want to go. Where should we go? Our direction forward. And it basically just reinforces what Speaker Egoff was saying. We want to be able to expand that small amount that we saw there in 1.8%. There's a lot of opportunities there in New Mexico. We're uniquely situated in the Southwest for new solar plants, both photovoltaic, that's what PV is, and also concentrating solar. And there's a lot of folks been doing great work in this, and I think this is an opportunity for us in New Mexico, as well as expanding the wind energy, and also at all different scales, for residential, commercial, government, rooftop solar. We need to go that direction, utilizing our geothermal resources. And also we need to be able to expand or electrify our transportation sector. Remember from that pie chart, we were basically at 28% of our greenhouse gases are from transportation. That's something we need to really focus in on, is using renewable energy to power our electrification of our transportation sector. Everything from our everyday cars that we use to our transit and the transportation sector as a whole. And also we need to really not only just do those, but we need to have plans that looks at resilience and adaptation. So we need to not only be able to plan for the mitigation, but we got to have that response. So we know what things are going to heading, what do we need to do as a society, as individuals, school systems, all the way to agriculture, tourism, all the different sectors coming up with statewide resilience and adaptation plans. So those are, we're on our way there, but we still have quite a ways to go. So I think that's about it I was going to talk about. And last slide, just my contact information. Thank you for the opportunity.
Dr. Dubois, thank you for the great information. Really appreciate it. And now we're going to go to Adele Begay, and who comes to us from DNA Cares and is a public health nurse. Adela.
Okay, slide 1. Yate Abene, I am Adela Begay, board president of DNA Citizens Against Ruining Our Environment, and a retired health professional. Slide 2, please. I am here today to talk about tribal health and the public health implications of climate change and oil and gas pollution on our communities. COVID-19 is of a paramount concern on the Navajo Nation, and I have spent the past several months volunteering as a contact tracer, and I also monitor the health status of those afflicted with COVID-19 infection in an area that had the highest concentration of cases in the U.S. I witnessed firsthand why we are at high risk for COVID-19. Those factors include scarce and unsafe water and food, poor sanitation, substandard housing, and overcrowding, exposure to environmental hazards, limited access to health care and public health service. Slide 3. The COVID-19 crisis shines an even brighter light on our air quality. Air pollution exacerbates lung disease such as asthma and emphysema and can lead to heart disease. Moreover, the Center for Disease Control warns that people with underlying health conditions are most at risk for serious complications and adverse outcomes from COVID-19. We must protect our health and our climate in this time of crisis. For close to 50 years, we Diné have been surrounded by 7 power plants with all its pollutants, uranium mining exposure, now oil and gas pollutants. These pollutants are linked to developing all types of comorbidities. Air pollution does not stop at tribal, state, or national borders. We all breathe the same air, drink the same water, depend on the same climate, and have the same dreams for our children and their children. Slide 4, please. Navajo leaders and community members call on our state and federal governments to do more to limit pollution from oil and gas development and clean up our air. Ozone pollution from methane emissions poses a serious threat to the health of all New Mexicans, but disproportionately impacts children, Native Americans, and those living in poor rural communities. In fact, more than half of all Native Americans in San Juan County, about 25,000, live within a mile of an oil well site. Slide 5. After voicing concern for years about sudden and unusual health symptoms experienced from breathing polluted air around oil wells near homes and roads, a health impact assessment conducted earlier this year in the Navajo Nation areas of Councilor Torreon and Ojo chapters examined potential childhood and birth impacts due to exposure of oil well emissions, including interference from developmental processes within the brain from exposure to toxic agents, and more toxic per pound of body weight than adults because children have higher respiratory rates and less ability to metabolize some toxicants. More than 80% of counselor residents that participated in the health assessment reported symptoms from exposure to volatile organic compounds, including eye and respiratory tract irritation, headaches, dizziness, visual disorder, fatigue, loss of coordination, allergic skin reaction, nausea, and memory impairment or inability to concentrate. Long-term effects of VOC exposure include damage to the liver, kidney, and central nervous system. Other harmful effects in the community or from the industry include increased truck traffic, increased noise pollution, and loss of grazing areas that some people still make their living from. Slide 6. As Dr. Dubois has presented, New Mexico is already experiencing negative impacts from climate change. The climate crisis also poses unique risks to the Navajo people. More climate change means less water and more heat waves. Increased temperatures have significantly altered the water cycle in New Mexico. This is especially dangerous to the Navajo people, where 30% of the residents do not have municipal water supplies and 40% of residents do not have electricity and cannot cool their homes in the summer. We are already experiencing water shortage. Many of my people are driving 60 miles to haul water for themselves and their livestock every day. Many of our water sources on Navajo land have been contaminated by uranium, oil and gas pollution, coal mining pollution, etc. Furthermore, the Chusca Mountain on my homeland is an important watershed and provides water to surrounding communities. Now, helium fracking is increasing along the mountainside in different communities. Drought is drying the land, thus increase the risk for wildfires. Further endangering our watershed, the drought has already impacted those Diné who follow a lifestyle of self-reliance, living off the land. Many Diné ranchers are now selling off their livestock, and this only makes us more dependent on others and the government. Families that have planted and farmed are finding it hard to grow traditional and homegrown healthy food for their use. The change in climate is making many of our traditional medical herbs disappear. For a community that already has too little access to clean running water for drinking and washing, and whose elders are especially vulnerable to rising temperature, climate change presents a public health emergency. The impact of climate change will disproportionately impact Native communities. This is a social injustice. The most effective method to reduce pollution, prevent toxic exposures, and improve public health is to trap and reduce emissions at the source. Emissions should be contained on all polluting oil and gas equipment, including wellheads, tanks, compressors, and pipeline valves. A strong, comprehensive methane rule is critical for climate and environmental justice for the Navajo Nation and for all New Mexicans. Dene Cares thanks Governor Michelle Lujan Grisham for committing to nation-leading rules, and we look forward to more ongoing conversation among Navajo leaders and community members. Thank you.
Adela, thank you for that very important overview of what's happening at Navajo Nation in relation to climate change and public health issues. So again, I'm Barbara Weber with Health Action New Mexico, and I just want to talk a little bit about the connection between climate and public health. From everything you've already heard from other presenters, the fact is that air quality in New Mexico is deteriorating. There's no doubt about it. Our air quality is deteriorating, and our health is based on the air we breathe, the water we drink, and the ground that produces the food that we eat. The American Lung Association, in its recent report, gave Eddy, Lee, and San Juan counties failing grades for ozone pollution and high ozone days. And the nearby energy-producing counties didn't fare much better in their report. The 5 New Mexico counties home to 97% of the state's oil and gas are all at risk or already in violation of the federal clean air standards. So there is no doubt that ozone pollution poses a serious threat, especially for children, for elders, and for rural communities of color. Oil and gas is responsible for 300,000 metric tons of the compounds that turn into ozone or smog every year. An extensive body of scientific research, including from the U.S. Environmental Protection Agency itself, demonstrates a causal or likely causal relationship between ozone exposure and respiratory distress, heart problems, premature death, strokes, and neurological effects. Especially troubling, as Adela said, in our current public pandemic crisis, is that those people with respiratory and heart conditions are at greater risk for worse outcomes in COVID-19. One of our major issues is to protect children, and because they, as was said, are at most at risk for a lot of the impacts of climate change and air quality. Asthma is now the most common non-communicable disease of children in the United States. In New Mexico, our asthma rate is higher than the national rate. The highest ER visits and admissions due to asthma are in the southeastern part of New Mexico. In New Mexico, we have over 138,000, almost 140,000 people who live within 1/2 mile of active more than 550,000 oil and gas facilities, as do 99 schools and child care centers. So what we know, and there's a lot of information, but we're going to share just some of it, that for people living close to oil and gas facilities, It increases the risk of congenital birth defects by 40 to 70%. It increases low weight and preterm babies 40% and 20%. And it increases the lifetime risk of cancer by 8 times. So there's no doubt that oil and gas contribute to part of what's leading us down the road to climate change. Oil and gas operations leak, vent, and flare methane into the air. Methane is the principal component of natural gas, and in many cases in New Mexico, we elect not to use the natural gas, but to simply burn it off, to flare it, in addition to the leaks and to the venting that you see. Methane is a powerful greenhouse gas responsible for more than 25% of climate change. Again, I want to repeat, methane is responsible for more than 25% of climate change as a powerful greenhouse gas. But the good thing is that it stays in the atmosphere less, so if we can mitigate it, we again have a more powerful tool to reverse the path we're on now for climate disaster. New Mexico, unfortunately, is home to some of the worst methane population in the United States. Methane escapes from the wells in the Permian Basin at a rate of 3 times higher than the national average. New Mexico leaks more than 1 million metric tons of methane into the air every year, the equivalent of the carbon produced by 22 coal-fired power plants. As many of you will remember, a few years ago, a massive methane hotspot was discovered over the San Juan Basin by satellite, equivalent to the size of the state of Rhode Island. It is the largest methane hotspot in the country. Volatile organic compounds are the gases that are released alongside of methane and are the key ingredient that lead to smog and ozone. Benzene is one of the key concerning key gases that is released because it's a known carcinogen. Others lead to neurological defects. In fact, exposure to some of the ozone of only 1 hour of some of these compounds can lead to cardiac arrhythmias. So there's no doubt that there's a strong link, and we've only gone over a little bit of the information that's out there about the link between health and climate change and air pollution. But what is of concern, given all the information that we have, is that the Trump administration has accelerated its campaign against environmental and health regulation. In fact, just this month, the EPA rolled back and actually gutted all of the federal methane regulations. This follows 3 years of having rolled back environmental regulations. The good news, and we want you to know that there is good news, that oil and gas developers have solutions for their at their disposal for the issues that we're talking about. There are drop my paper here. They are give me 1 second. There are infrared cameras that find and fix leaks. The companies can install state-of-the-art technologies that emit little or no air emissions And companies can develop, as you heard Speaker Egoff discuss, capture plans, gas capture plans before development, so that air and methane emissions are not an afterthought, but are not part of the process. As you heard from the Secretary Kunkel and from Brian Egoff, Speaker Egoff, we have a commitment on the part of Governor Lujan Grisham for climate change. You heard about her executive order on addressing climate change and waste prevention. And not only do they have current plans, they have existing plans. And they have committed to the strategy mentioned by Speaker Egoff to reduce greenhouse emissions by at least 40% in 2030 as compared to the 2030 levels. So where are we now? We have in New Mexico drafted and have the preliminary rules for methane and ozone regulation. And while we appreciate the hard work that the state agencies involved, the Environmental Department and the Energy, Mineral, and Natural Resources Department have done, we still feel that there's critical changes that they're going to have to make because there are loopholes and exemptions in their draft proposals that they have for both air pollution and for methane rules. On this slide you see, and we will be sending these out to you, there are time for public comment, and we really want everyone to be making public comment to address the loopholes and the exemptions that are in the current rules that weaken the rules and don't take us in the direction that we think the governor anticipated we would be going. So we are at a critical point in New Mexico. We want to see what can be done and what call to actions can happen right now in New Mexico. And for people on this call, what can we do? And the first thing that we can all do is to learn more. All of the sponsoring agencies have websites with lots of information, and there are a number of environmental groups that you can go to, as well as the Departments of Environment and Energy and Natural Resources as well. Right now, an important thing, especially since we're in the election time, is to let candidates for office in your local office and your local state and federal representatives know that for you, combating climate change is a critical issue, and you need to ask what their position is and follow whether they follow through on their actions. Again, very important if we're going to address this issue. Following the state process for regulating methane, you can follow that on the websites that we've linked you to. And again, really important to say that we have public comment into the two departments by September 16th. It would be unfortunate that though they have set out a lot of good directions, that the loopholes and exemptions in the rules undermine where we need to go in New Mexico for addressing these issues. And as, again, Speaker Egoff said, we need to call for comprehensive strategies that set carbon limits and require significant reductions in greenhouse emissions in all sectors in New Mexico. So with that, we are going to move to questions. And if I want to remind you, if you are on the phone, you can either use the chat box that is there, but if you're on the phone, you can also do *3, and that will take you to a person who will get your questions to us. So I have a couple of questions that have come in. In fact, I have a number of questions, so we're going to go through them as quickly as we can. The first question is, what specifically are some of the shortcomings of the state air pollution and methane rules? Great question. The environmental rule would exempt the vast majority of wells from leak detection and repair requirements, which is really unacceptable. And we hope that Secretary Kenny will direct his agency to remove these loopholes. When the Natural Resources Department has developed a common sense approach to methane waste rule, they still need to limit venting and flaring by county and region instead of, as they have done it, in general, and require enforcement of gas capture plans. While it is critical that exemptions from stripper wells in the 15 tons per year pollution threshold for volatile compounds be removed, these two exemptions combined would exempt 95% of all wells in New Mexico. Again, I want to repeat, the exemptions for stripper wells and the 5 tons per year pollution threshold for volatile organic compounds needs to be removed. For these two exemptions exempt 95% of all the wells in New Mexico. The Oil Conservation Division has set an appropriate goal of 98% for all gas to be captured. However, if that requirement is not set by locality, companies with operations in both parts of the state, in San Juan and the Permian Basin, could have all the reductions or recur only in, say, the Permian Basin, and this would disproportionately affect Navajo and Latino communities in the San Juan Basin. The Oil Conservation Division should set the goal on the basis of locality, such as a county or basin. Again, public comments are due by September 16th. Next question. Once the state air pollution and methane rules are in place, what is the next step for New Mexico to combat climate change? As Speaker Egoff said and Dr. Dubois, we must adopt comprehensive strategies that set emission limits to reduce carbon dioxide and other greenhouse gases across all sectors of the state. Next question. What is the short, long-term drought forecast for New Mexico, and how is climate change making an impact on this? Dr. Dubois?
Yeah, great question. Thank you. So right now I'm just looking at the current drought map, and approximately 94% of the New Mexico is in drought right now. And then we're just looking at the outlook for the rest of this year and actually into 2021. I don't have any good news. We're heading into a La Nina winter, and a lot of those La Nina episodes in the past for New Mexico have yielded warmer and slightly drier conditions during the winter. So that's not a good path that we're looking at. So we're trying to figure out is, what can folks do to prepare for potentially less water in next spring. So looking at, a year from now, what are some of the options and also scenarios that we need to put together. So that's kind of where I'm laying it out. Is it that, we could get a normal winter, but there's probabilities are looking for more of a drier and warmer winter, so that's not good. And then so that means the areas that are in drought now may not get relief. There may be a few areas that may get some good rain, but overall we need to prepare for another dry winter.
Here's a related question. I've seen that information that New Mexico is heating faster than other states and is already at 4 degrees above normal. what is the top action that we as individuals can take to reduce emissions? And that's for you, I think, Dr. Dubois.
Hold on here. My phone is acting up here. I got phone calls coming in. Can you still hear me?
Yes.
Oh, okay, great. Sorry about that. With our looking at it in terms of the future, we're the most probable thing is warming temperatures, and so I think we need to be able to put together strategies that deal with heat on different levels. I mean, we're in summer right now, so we're feeling the heat, so we need to be able to have resilience in all different sectors, with hospitals and with the sector of our population that's at more risk, and the older folks and some folks that are in rural areas that may not be prepared, some of the urban areas that are not be prepared. I was just thinking about maybe with the wildfires, it kind of adds in more complexity and more risk. Is having bad air outside, but then you're stuck inside. But then if you have a swamp cooler, then the recommendation is not to run it, because that basically brings in outside air in. But if that's your only options for cooling, then there's a problem there. So I think we need to think through that across our societies. And a lot of people are very resilient. I mean, you got air conditioners, they have a place to go, but there's a lot of people who don't have it. So I think some of those kind of things that we need to really bring ahead and forward and let people know about. I mean, there's tons of things, and the Department of Health is thinking about those things. I think we need to communicate that out, let people know, and we need to care for each other. Or think about our neighbors more, and on during those times.
Okay, great. Adela, here's a question for you. Is the state actively trying to provide clean water, running water, to the tribal areas that currently don't have access to it?
I don't really think so. I mean, I know right now that with the CARES Act, that had to do with the COVID funding, there's a lot of plans to get some water to the communities, but I do understand that the law or the monies are really the funding is really stringent. So I think it's really difficult to do anything from the leadership to bring more water to the people.
Okay. Next question. How do we address the issue the state does not have enough people to inspect wells and pipelines, and there is not enough state income to hire people? I guess I'll take a shot at that. I think that's a great question, and it's one of the things that must be addressed. There are going to be, in the next session, a lot of priorities that are going to have to be looked at with constrained resources. And yet, if this is really going to be a priority for the state, we're going to have people to do the inspections and to carry out what we can do to prevent to mitigate methane. So great question, and unfortunately Brian Egoff isn't here to address that. But I think that that's a question that we want to ask our legislators to make sure that they are prioritizing combating climate change. So here's a question for you, Dr. Dubois. What is the potential for greater use of geothermal statewide as a source of energy?
That's a great question. I think that we do have resources here. It's a matter of thinking through. So how do we use those, and what is the best way to do that? I'm not an expert at all on geothermal. I would have to refer to you on all the intricacies of that. But I think that's a resource that other states have dipped into, and and we had to figure out what's the where and how do we do it sustainably and environmentally good, you know, in terms of not disturbing a lot of land. So there's a lot of questions, but we need to do that. But I think it's definitely a positive way, positive direction we go and use.
Great. I'm going to take one more question, and then we're coming to the end here. How do racial and ethnic groups differ on exposure to environmental risk in New Mexico? Della, do you want to take a shot at that, and I'll back you up?
Could you repeat the question?
Sure. How do racial and ethnic groups differ on exposure to environmental risk in New Mexico?
Well, I do know when I talk about the social injustice, there's just, I think that's what the question is. You know, we have been exposed to a lot of pollutants that actually exacerbates or are linked to comorbidities that makes us unhealthy in the long run, and not even having water, running water, makes us, you know, not safe or be resilient to a lot of other health and illness. And I think just not having the infrastructure, it takes a long ways to go to the health facilities, and not having the resource and money to have enough health professionals around, those type of things. So I don't know if I answered the question correctly.
I think you did, Adele. I think you did a great job. There's no doubt that as particularly you look at where environmental risk can be the highest, it's everywhere across the state. Certainly the oil and gas industry workers are more at risk, and people who live in the environment, either in the southeastern part of the state or in other, as Adele said, in the San Juan Basin. So there's no doubt that our rural communities have fewer resources. They have higher numbers of elders. They tend to be poor, so they suffer more, consequentially, the risk from the environment. Great. Let me see if I have one more time for one more question here. I do want to answer one question I'll answer two questions that came in. One would be people want to know if they would have access to this recording. And yes, we will have that available to people. And also we'll send out a thank you letter to everyone who participated with some of the information on where to write to send your comments on the methane rules. One person wanted to know if we were, if community groups were joining together, and to let you know that yes, there are a lot of groups, nonprofits, business people, faith communities, community organizations like ours, and environmentalists who are working on the methane rules as a top priority. So I want to thank everyone. We're at time, and thank you for attending the webinar. I hope this is the first of many conversations that happen in your lives, in our lives, and across New Mexico to really address climate change and to be aware of the public health impact that climate change has on our lives. And thank you to our participants, our panelists, and to our co-sponsors.